Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to the new season of Thriving with ADHD, dear ADHD community. We are delighted to be back after the summer break. We can't wait to explore ADHD and mental health related topics with our amazing medical team and guests. And certainly, there is no better way to kick off our second season than having Animo Sano's PA-C Maddison Henley with us. Maddison and I are going to discuss ADHD in females. Before we jump into the conversation, here is a bit more about Maddison. Maddison is a dedicated physician assistant with a passion for mental health care. She has worked in outpatient behavioral health care since 2021. Her commitment to providing compassionate and comprehensive care is evident in her approach, always ensuring that her patients feel heard, understood, and supported. Maddison, I am really excited to have you back in the new season of our podcast. Welcome back.
Thank you. Yeah, I'm excited to be here.
So we have an important topic today, and it's ADHD in females. How to recognize it, how it is different, challenges, and so on. So let's get started. I suppose my first question for you is, why is it challenging to recognize ADHD in girls and women?
Yeah. So I can get into those. I think that a lot of times, especially, I don't know, just thinking back, like before I got into medicine and behavioral health and specifically, like I would always hear this picture of ADHD, and I feel like everybody always just assumed that whenever somebody was talking about ADHD, they were like referring to this like super hyperactive young boy that was bouncing off the walls in the classroom or something like that. And I feel like that just kind of goes to show like how maybe it's just a lot more recognized in boys and men than maybe it is in girls and as we get older into women. And so I think that that's also led to ADHD just being predominantly more studied in boys, and even like the criteria and diagnosis and all of that, like just being observed in younger boys as they're growing up and into adulthood. Um, and while maybe boys tend to have a lot of those hyperactive symptoms, like girls sometimes are maybe a little bit more often have some of the inattentive symptoms that are sometimes a little bit less noticeable than the hyperactive symptoms. And so, yeah, the impulsivity too tends to be maybe more common in boys and more recognized because it can lead to kind of more, I guess, that's an opinion, but more like damageable effects or so forth. And that girls and women might kind of internalize some of those symptoms and then that might lead to other difficulties like depression, anxiety, other behavioral health symptoms that can kind of spiral off of those. And then also just kind of society as a whole having certain expectations and kind of stereotypes about gender roles that might overshadow some of those symptoms in females, and I think I'll get into that a little bit later too. But yeah, that's kind of why it's maybe more challenging to recognize some of those symptoms in girls. But yeah, I can also, if you want me to, go ahead and get into how it can sometimes present differently in the two.
Yeah, so let's see how ADHD presents then in girls and women.
Yeah, and obviously none of it is like hard and fast rules. Obviously, anything that I'm talking about
Yes.
in females can also present in males, and vice versa.
Okay.
So yeah,
I
but
presume predominantly, maybe.
yeah,
Okay.
and maybe some of the more unrecognized ones and things like that. But oftentimes in women, the manifestation of ADHD kind of leans, like I said, towards a higher prevalence of those inattentive symptoms.
Mm-hmm.
And so that can have a range of different things like having trouble maintaining focusing on tasks, forgetting small details, careless mistakes, maybe just feeling like generally a little bit disorganized,
Mm-hmm.
in maybe a bunch of different areas like work, school, home life, personal life.
Mm-hmm.
And so then those things might be a little bit more subtle, and that might be a little bit more challenging for not only providers but like the individual themselves to identify as different indicators of ADHD. I think too, women with ADHD sometimes tend to internalize those symptoms, like I mentioned before, and so maybe just knowing that ADHD is less common in females, or feeling like it's less commonly in
Mm-hmm.
females, they might assume like, oh, like these things aren't actually ADHD. Like I'm just struggling with getting my things organized, or being on time. And so that can also lead to like low self-esteem and things like
Mm-hmm.
that, doubting whether or not they're able to achieve what they're wanting to achieve. So anxiety can be pretty commonly comorbid with ADHD in women, even from what I've seen in clinical practice too.
Mm-hmm.
A lot of times it can be very damaging to self-esteem, and just feeling anxious and really getting into like, well, why are you feeling anxious? And they're like, oh, because my boss is on to me about this. I've missed this deadline. I forgot to pay this bill, and so it really can like impact a bunch of different areas, creating a lot of stress, worry, which then can sometimes worsen ADHD symptoms. So, yeah, and a lot of times too. So I mentioned before, like ADHD tends to be characterized by hyperactivity,
Mm-hmm.
impulsivity, and a lot of times when we think of that, we're picturing maybe males instead, and that can include things like restlessness, not wanting to sit still, whether that's at class, work, meetings, um, and then maybe just acting on things impulsively.
Mm-hmm.
A lot of times we'll see like spending habits as an impulsive thing, maybe interrupting people when they're talking. Um, Different kind of impulsive behaviors like that, and
Uh-huh.
so they're a little bit more easier to kind of recognize, especially from caregivers from a young age, teachers
Uh-huh.
in the classroom, and even like as we're getting older, like in relationships and things like that. They're just the hyperactive symptoms tend to be a little bit more easier to kind of pinpoint, and maybe label as being ADHD compared to the inattentive symptoms. So yeah, I think that's where maybe part of the diagnostic gap comes from, in recognizing ADHD in women. And then I also mentioned too, like the societal expectations of women being labeled
Mm-hmm.
as like caregivers, or the nurturers, and so sometimes I feel like that can kind of mask the extent that they struggle with different symptoms, and kind of leading to a delay in diagnosis at times, just because they have all of these other rules sometimes. Not to say that men don't, because I know there are some dads out there that do those things too. But but yeah, just those kind of gender roles that are labeled on people in
Mm-hmm.
the society sometimes, and that internalization can kind of overlap with other mental health conditions too. And so sometimes it's trying to kind of tease out, like I said, like if somebody initially comes to me and they're just like, yeah, I'm just feeling really anxious. And then we really get into it and
Mm-hmm.
we're finding out all of the reasons why they're anxious. And then
Mm-hmm.
we're kind of seeing the root cause of like, well, yeah, you're anxious because you're super disorganized, and you're never on
Yeah.
time, and you have a really hard time starting and finishing tasks, and all of these things. And
Yeah.
so, so yeah, I think that answers the question.
Okay, so can we talk a bit more about the actual symptoms of ADHD in young girls and women?
Yes.
Mm-hmm.
So yeah, sometimes we see in younger girls that some of the difficulty focusing, and so like examples of that might be like having trouble persistently with staying focused on different tasks, maybe in school and at home, not being able to follow through with like chores, or maybe just drifting off in class and losing their train of thought, things like that. And so sometimes that can be maybe misconstrued as lack of interest or motivation when really it's just them having a lot of trouble actually sustaining that attention. Forgetfulness is another one. They might misplace things, forget what instructions you gave them to do something, and it's important to note that it's not like an intentional forgetfulness. It's really just a symptom of
Mm-hmm.
that different wiring of their brain, where they're having those memory and organization skills.
Mm-hmm.
And so that can come out as frustration sometimes in younger girls as well. Um, like I said, kind of going along with that, trouble organizing tasks and activities. So maybe not being able to plan their time efficiently, maybe not being on time, like when you ask them to get ready, not completing assignments, having trouble like participating in extracurricular activities.
Mm-hmm.
And it really can hinder like their academic progress, social participation, different things like that. Being easily distracted is a big one. Kind of finding it hard to focus on just one task without uh, getting distracted by that noise over there or somebody walking across the room. Um, and that's something that can be a little bit easier to pick up on, like in the school setting, in the classroom setting.
Mm-hmm.
Daydreaming is another big one in women
Mm-hmm.
that it, or it tends to be a little bit more common in women. That is pretty easy to go under recognized as well, just because they're having their own little world and they're kind of staring off into space and not maybe focusing on what is less interesting in front of them or in class or what their parents are saying or what have you. And then I mentioned like sometimes trouble following instructions. So things with multiple steps or forgetting some of those steps. And sometimes even that could be like perceived as being disobedient or they're not trying or they're lazy or different things like that. So those were some that might be more common growing up, and then kind of as we age and get into adulthood, um, those can lead to kind of chronic feelings of feeling overwhelmed, maybe experiencing um, kind of that building upon being so disorganized and so trouble with keeping up and being on time and then just kind of this chronic feeling of overwhelm and I can't do it because all of these things are stacking up and now there's no way that I can get to
Mm-hmm.
all of them now. Um, a lot of times we'll see that they are very poor at managing time. They cannot make it to anything on time. They lose track of time. We call it time blindness sometimes
Mm-hmm.
with some of my patients, just because it really is. It's like you need to have that physical clock in front of you to be able to be aware of what time it is, and so that can lead to missing deadlines, which then can increase stress, especially if it's affecting people academically or
Mm-hmm.
in the job setting or even in their personal lives. And so self-esteem, feeling unachieved, different things like that. I mentioned kind of that cycle of anxiety and depression that
Mm-hmm.
a lot of times we see where you're really anxious because you have all of these things stacking up or
Mm-hmm.
feeling down about it, but then you're finding less motivation because you're anxious or feeling down and so the two really do tend to feed off of one another, and so that can even kind of bleed over and start making it harder to maintain relationships due to kind of all of that, and so that's another one there,
Mm-hmm.
but yeah, I think that's some of the more common ones or some of the presentations that we see with symptoms.
Okay, so it seems to me that often ADHD could be perhaps recognized and or judged as a character trait rather than being detected as actual condition in women and girls just because of the way it presents.
Yeah.
So, is it why ADHD is often overlooked and misdiagnosed in women, or are there some other reasons, perhaps?
Yeah. Yeah, so I think, I mean, part of it there's probably a wide range of reasons, but
Yeah.
part of it's probably just because, like I said, sometimes the symptoms can be a little bit more subtle in women.
Mm-hmm.
Um, they can be subtle, internalized, kind of compared to men,
Mm-hmm.
and that might make it more challenging for healthcare professionals to identify it.
Mm-hmm.
And like even just growing up, for caretakers who are typically the ones identifying those sorts of things in childhood. Um, and I think too, just a lot of the studies have been kind of predominantly centered around males as well. So that could be another reason. I think too, like the overlap of ADHD with other mental health conditions.
Mm.
Um, the symptoms can kind of coincide with other things like anxiety and depression, and so it's kind of a complex clinical picture sometimes, and
Mm.
so that can potentially lead to a misdiagnosis or treatment plans that aren't working because maybe it isn't just depression, it isn't just anxiety,
Mm.
and I think too that that even goes into a whole other tangent of that we could get into another time. But like just in our society today, I think a lot of even healthcare providers are so like averse to prescribing things like stimulants that in their head they're like, well, they have anxiety. Let's just label it as anxiety because I don't want to prescribe a stimulant or different
Mm-hmm.
things like that. And so even like as healthcare providers, I think with men and women that can be a kind of barrier to a diagnosis just because of the stigma that comes along with a lot of the treatment options
Uh-huh.
with
Uh-huh.
ADHD.
Uh-huh.
But we'll save that for a different
Some
time.
other
um,
conversation. All right.
yeah, yeah. But I mean, also just societal expectations or
Yeah.
stereotypes in general with
Yeah.
kind of thinking like, well, women should behave like this or I don't know. I feel like that can
Yeah.
influence the perception of ADHD
Yeah.
symptoms in certain demographics. So yeah, we often think like of our moms as being like nurturing, attentive, organized, and not
Mhm.
the kind of chaotic person who couldn't get us to soccer practice on time or whatever.
Yeah.
And so yeah, there's sometimes that stigma there, and then just the ability to develop all of these coping mechanisms that maybe help to mask some of those symptoms. So
Mhm.
um, I'm trying to think of ones in specific that some of my patients have said, but they're like, well, yeah, I am really bad at organizing my time, but I have this Google Calendar now that I can literally plug in everything to, and I base my life off of this thing. But if I didn't have it, I would be all over the place and never to anything on time. So I mean, there's all of these different coping mechanisms that people can do. I have one patient that works in healthcare and she'll like put different things in her pockets to remember like what she needs to grab when she goes out of the room or different things
Mhm.
like that. And so they come up with these different kind of coping strategies to kind of mask some of those symptoms that they've been dealing with their whole life.
All
So
right.
that might be kind of another reason why it could be overlooked
Mm-hmm.
because they found these ways to kind of deal with them since it's been going on for so long.
All
Um,
right.
yeah,
Okay, we'll talk about coping strategies a bit later, but I first want to touch on what are the consequences of the condition not being recognized.
yeah, a lot. No, I mean, I think we could break it up. I mean, obviously, there's academic consequences growing up. I think though it's hard sometimes when patients have a high IQ or they are like really high
Mm,
achieving students, and I feel like sometimes there's a stigma that you can't have ADHD and get good grades, but
mm,
I do see sometimes where, like in elementary school or growing up in kind of grade school, they were able to kind of get by just because the material was easy to them and they were
mm,
naturally really smart. But then once they get
mhm,
to college and things pick up, they don't have the structure that they had at home, things like that. The symptoms just kind of spiral out
mm,
of control. Um, and so certainly in an academic setting, career underachievement, maybe not being able to move up in their career if they're not meeting deadlines, looking appealing to their supervisors, things like that. Um, kind of that chaotic presentation that
mm,
sometimes we see. Um, increased risk, like I said, with comorbid conditions, anxiety, depression being kind of two of the big ones. Insomnia, I know we've talked about that in the past.
Mm-hmm.
So those are big kind of comorbid conditions.
Mm.
Um, Struggles with self-esteem, self-worth, those are big ones. Obviously, if we're kind of continuing down uh, this disorganized lifestyle, not getting the treatment that is correct, and maybe it being labeled as something else, then it's very common to just kind of feel this low self-esteem.
Mm.
Um, because you're not able to achieve all of the things that maybe you're setting out to do, or wrap up those details and projects or schoolwork and everything. Um, Also difficulty with relationships.
Mm.
I have a lot of patients who they're like, well, yeah, my partner said this, my partner said that. And it's like, yeah, yeah. ADHD definitely impacts our relationships.
Mm.
Like I said, things like interrupting, impulsivity can be big ones, but even
Mm.
just not paying attention when your partner's talking or not listening to what they're saying or not being able to finish your chores around the house and maybe your partner's feeling like things are really one-sided. So
Mm.
those can be just some of the many repercussions of ADHD in relationships. But then another big one too that we see is if ADHD is improperly treated, sometimes there can be an increased risk of substance use
Mm.
as well, not only from just impulsivity, but just kind of those not feeling like any of the medications are working or things like that. They might turn to other substances instead.
Mm. Mm.
So yeah, those are some of the different kind of consequences there.
Mm-hmm. And you mentioned a few nice coping strategies that our patients have to help them manage ADHD knowingly or unknowingly. So,
Yeah,
if you can maybe talk more about strategies have proven most effective for,
yeah,
well, I suppose it's not just for women, but for everyone coping with ADHD.
yeah. Yeah, I mean, I always tell my patients, like, obviously medication isn't perfect and there's things you're gonna have to do on your own to kind of
Absolutely.
help
Yeah.
bridge that gap. I think therapy is one of the big things that can be a really good coping strategy in itself. Just having somebody else there to kind of drive you and push you to implement maybe the coping strategies alone that you're trying to do yourself.
Mm.
Um, Maybe somebody to bounce ideas off, things like that, and just somebody who is a supportive person in your corner. Different organizational tools. I mentioned Google Calendar. That's a big one.
Mm.
Definitely other forms of calendars. I know some of the therapists that see some of my patients. They recommend them having like a physical uh, planner with them
Mm.
all the time because you're writing it down, remembering it better. It's with you all the time, things like that. Obviously, though, we have our phones with us all the time, most of the time. And so there's a ton of different apps out there. I think we
Absolutely.
have some of them on your website, but sometimes I'll look into those and I feel like I have patients telling me every day like different new apps that they found um, that really help with organization and just like keeping all of their stuff together, their tasks managed, kind of sorting out what needs to be done first, what can wait a couple days, what can
Mm.
wait a couple weeks, things
Mm.
like that for more effective time management. I think too, having a really good support system is a good coping mechanism. Having people that are going to understand the challenges that
Mm.
our patients with ADHD are facing, so that um, maybe they'll provide a little bit more support and not kind of jump to, well, why do you do it that way? Why aren't you doing it this way? Kind of
Yeah.
thing.
Yeah.
Um, yeah, and just coping through other outlets like physical activity, making sure you're getting good sleep, different things like that, eating good meals,
Mm.
all of those things are really important as well. But yeah, I think that there are a lot of tools available to ADHD patients now, especially with all of the technology that we have. Um, yeah,
Yeah, thank you. Yeah, and I think we are big on not only treating ADHD with medication, but also having all these other non-medical means to manage the condition. So it's very, very important. You mentioned some of them. So to conclude this episode, if there is one most important thing that you would like our listeners to take out from this episode, what that would be?
Yeah. I mean, I think the most important takeaway would be that ADHD in women is commonly unrecognized, or
Mm-hmm.
maybe just misunderstood in a way, and that it is important to be aware of the different ways that it can present in women
Mm-hmm.
compared to men, um, so that we can maybe recognize it a little bit earlier on, especially in childhood before things maybe spiral out of control,
Yes.
or just to improve like quality of life. Like I've had so many women who were like, "Oh, my parents were always like that couldn't be ADHD," and then we start them on treatment, and after a proper diagnosis, and they're like, "My life is so much different now. Like I'm doing so well at work. All of my friends are noticing, my partner is impressed." Like I really think that it's just so important to get the correct diagnosis, because if we're not treating the right thing, then it's like it's no wonder it's not responding to an antidepressant, because it's not depression and different things
Yes.
like that. And so
Yes.
I think it's just really important for their quality of life to make sure that we're getting the correct diagnosis, getting the correct treatment plan, so that we can kind of help them live up to their full potential and feel achieved and everything like that. So, yeah,
Thank you so much. I feel hopeful after this conversation with you, and hopefully this will encourage women to seek help, to test themselves. It could be that it's not ADHD, but if it is, the quality of their life could be so much better. So
yeah,
yeah, thank you for this conversation. I really enjoyed it, and thanks for coming back to our podcast. And I hope we'll see you with some new topic very soon.
yeah. Thank you.
No problem. Bye. Thank you.
Bye.
Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.